I think that process looks like finding a good person you trust. Ideally, there's a vibe check and you find a therapist who you trust, who feels safe enough to receive negative criticism on their performance, right? Like somebody who really does have enough, like, I'm trying to think of the word for it, but like enough window of tolerance, like enough ventral regulation, or like enough of them online that you can be like sort of back and forth with them, and like they're going to give you good feedback and be your loyal opposition. You find somebody like that, and maybe that person gets the autism mental status exam from online, right? And you guys just do it together, or you have a conversation about it, and it's like, does this make sense for me? Does it not? Because I do think that 3,000 hours that gets a person licensed matters. Like, I think all the things we do in graduate school matter. And to say those things are not important because I believe I'm autistic, great, doesn't change the fact that, like, you don't just become a plumber by like going out, I want to fix things, like, and just wrench them. Like, we don't just allow me, who has no plumbing skills whatsoever, to come work on the plumbing in your bathroom. It would end very badly. And so I don't think it's any different with diagnosis. And I think really, like, you find somebody you trust who has that loyal opposition, who has your interest at heart with you, you have a conversation about it. And from that conversation, you decide, do I want to get a referral for testing or not? And in some cases, testing is not accessible. And so self-diagnosis is a great option because sometimes employers will take that. I don't know that it's a one size fit all, but I do know that, like, having somebody who has gone through therapy school does matter.
Welcome to Therapist Uncensored. Building on decades of professional experience, this podcast tackles neurobiology, modern attachment, and more in an honest way that's helpful in healing humans. Your session begins now with Dr. Ann Kelly and Sue Marriott.
Hey, you guys. While we know relationships are wonderful, they are also really hard. Many of us believe that they shouldn't be, that if we have good connection and good communication, things will just go smoothly. But it's really that belief that can make us feel stubborn and even more hopeless. So relationships take work. It does for Sue and I. We can make it look easy. It's not. And one of the ways is because many of us, we differ. We differ in what activates us, what makes us feel threat, the expectation, and it's these differences that are held in our body, not our thoughts. And they influence how we talk, how we love, how we fight. So holding that belief, if he or she or they could just understand me, if they love me, they do something different, is not really true. And we're talking about relationships with your partner, your teenager, your mother-in-law. So Sue and I have created an online course that can help you understand yourself and those you love in a different way. This is not just for therapists, it's for everyone. Although the good news is if you're a therapist, you can get CEs along the way, and all of you can use the visuals and the worksheets individually, or you can even use them in your own private practice. So while the course is based on our book, Secure Relating, Holding Your Own in an Insecure World, it is definitely not a replication of the book. We talk directly to you. You learn how to understand more deeply your attachment, those you love, the neuroscience behind it, and how to build secure types of connections right now in your everyday relationships. Rather than changing one another, y'all can shift together in very important ways. It's very powerful. We're getting great reviews. Check it out. It's at therapistuncensored.com/BAS. therapistuncensored.com/BAS. The BAS stands for Beyond Attachment Styles, the Science of Growing Secure Adult Relationships. And by the way, the cost of the course is about the amount of one individual therapy session, and yet you get hours and hours and hours of what we think is extremely valuable information. So check it out.
Hey, everybody. Welcome back to Therapist Uncensored. This is Sue Marriott, and I'm here today with Dr. Sean Inderbitzen. He is the author of Autism in Polyvagal Terms. The conversation was fun and lively. I think you'll enjoy him personally, but also there's a little something here for everybody. In addition, if you happen to be in the Austin area and hearing this as it comes out, November 7th, Austin in Connection, an organization near and dear to my heart, will be bringing him in live. So if you're in the area, do please come by, austininconnection.org. You can find out more information. And let's get right to the interview. It is my great pleasure to bring you our guest today, Dr. Sean Inderbitzen. Part of why I'm very excited about this is for a long time, we have been interested, as always, in learning from outside the box and not doing just the straight traditional education that we've all kind of been a product of. And so it's a real value to have folks that have a perspective that is unique and different. He identifies as an autistic psychotherapist. He's also a researcher with the Mayo Clinic. Those of you that are in Austin on November 7th, Austin in Connection, an organization near and dear to my heart, will be bringing Sean in for a live presentation, a live workshop. So that's November 7th, 2025. If you're in the area, check it out. All right. Welcome to the show.
Thanks. I'm super stoked to be here. I've listened to this, and now getting to be on here is sort of like a little surreal.
Oh, wonderful. You know, sometimes we get started by just orienting our listeners by letting you describe yourself. So, what comes to mind? Who are you?
Oh my God, a watermelon came up.
Say
It's
more.
like you're like, don't think of the fruit ahead of time. No, it's one of my favorite questions. But like when you think about a watermelon, right? Like it's soft, it's mushy on the inside, but it has a really hard exterior. And I think anybody that works with me clinically, like as a client of mine, knows like I'm pretty direct, I'm pretty defined. I'm also like very soft. And so, but the softness is first met with this like rigid shield guardedness. And so I tend to present that way, although I'm really like not as nearly intense when you get to know me.
Well, already I feel like I've enjoyed the watermelon, you know, the meat of the watermelon, you know, quite quickly. So it's funny. What came to my mind was for myself was a pineapple.
That's a good fruit. I thought about that fruit too. Why do you pick a pineapple though?
Because I can be prickly. I can be perceived as prickly. I can be prickly.
Sure.
But same thing, you know, there's something sweet in there. And if I'm allowed it to be opened up, if I allow the opening up, there's some really good stuff in there. But it's not necessarily easy to get to.
No, I think that's part of the challenge of having defenses like that, right? Whether you're prickly or shielded, or it's just kind of the nature of the beast, right? Like it's just part of the thing.
That's our human journey, is how to shed some of these defensives that we've picked up over this lifetime.
To shed them when we need to and bring them back when they're relevant.
For sure. And the better we are at understanding different people's perspectives and how to open people up, it's a great lead in. Now, you identify as autistic. Would you mind telling your story about how you've come to understand that?
So I really like how you asked that question, how I've come to understand it, because it's a layered question. So I grew up not thinking I was autistic, not having any idea. Like I now have medical note documentation from my parents that like people were thinking it when I was like 2, 3 years old, but nobody wanted to name it. And so I didn't find out till I had this car wreck at 18. I left the scene of the accident. I'm like, I go to school. I'm like, I think this was the wrong thing. I'm like talking to one of my friends. He's like, why didn't you stay? I'm like, it's not written down. So like I call the police, they pull up, we do our thing, right? Like we work through it. But part of my legal defense was that I did have autism. And so I had to be tested and go through the process. But that was the first time at 18 I knew I had autism. And so it's like, oh, that kind of adds up in some ways. And so this has grown and changed and shifted. I've had autism be a giant blessing. I've had it be a curse. When I think about some of the ways it's been a blessing, when I came to North Lakes, I had worked with the Division of Oak Rehab. So I had actually not planned on being a therapist. I was going to be a policy analyst. But then I realized all those jobs are like 4 or 2 hours away from me. And I have these 2 little boys who are everything to me. And I have half-time placement of. And that placement is more important than whatever I'm going to do with my lifetime, because they're humans and they're just the best thing that has ever happened to me. And it's cool to be able to share this stuff with them. But I had to stick around to do that. So it was like, okay, that's out. So I applied to DVR, like said, hey, I have autism. Here's how it affects me. Here's how it affects my employment when I was at DVR as an employee. Like, and so like they paid for some extra classes. And then I got hired by North Lakes, where I work now, which is a community health center, about 6 years ago. And they let me work there And so I had to do some coursework because in Wisconsin, it only takes 3 courses plus the normal just MSW, and you can be a therapist, unlike the other fields like LPC where you do 60 credits. It's just like the height of arrogance about social work, I think, sometimes, but more on social work education some other time, I suppose. So that was like a really good time where my autism worked for me because I made a career out of, and as you're seeing now, as we're interacting, like saying, hey, I have autism and I do therapy, like maybe I can help you. And so people have really resonated with that message, as simple and perhaps messy as it sounds. I've also had it used against me. Like when I was going through my custody battle, the judge had a daughter with autism, and absolutely she's severely and profoundly impacted by that autism. So she's an intellectual delay. She has some cognitive delays. She's not able to live on independently in her 20s. And so the judge thought, can people with autism parent, right? Like that was a real thing. So I had to do like a whole parental fitness exam and go through this whole process because I have autism and his daughter has autism. And it's like, what does autism mean? It means a lot of things to a lot of people, but you hear the word and you think a thing, even though that may or may not be the thing in front of you.
So, what is autism?
Autism, I like to say, is this diverse population of people who are really joined by 2 key factors. And I look at this from a polyvagal lens. So I'm going to slightly nuance this in that way. As Stephen Porges was your guest, and you just said the physiocam person. I'm pretty sure Deb Dane has been your guest, and Ariel Schwartz. So I'm right in there in that family of people. But really, it's a biodiverse, and I say biodiverse meaning there's a number of presentations, right? There are a number of ways to understand autism. And really, it's around this idea of restrictive, repetitive, rigid patterns of interest and behavior. And then this idea of withdrawal and like social withdrawal and social challenges with social engagement, both with verbal and nonverbal communication. And that can present in a number of ways, right? So I was just at a conference keynoting in Virginia for the Spelling to Communicate folks. At the I Ask is what it's called, conference in DC. And so there was a room filled with 600 people. And so they have communication partners. They're called CRPs. And then there were several hundred nonverbal autistic people who were adults and had apraxia. And so are learning to communicate. So you can have that presentation. You can have mine, right? You can have Temple Grandin's, who's very like rigid, to the point, like very like, this is how it is. It's only this way, right? Might miss some social things too, right? And that's 3 different presentations of all the same thing.
And is it all the same thing, or are we lumping different things together? Do we know that?
So it's interesting, right? I don't know that we have a good answer for that because I think the answer has changed over the years, right? So like in the 80s or in the 40s, there were Asperger's and there was autism, right? So you had Hans Asperger and you had Leo Connor, right? So they thought there were 2 kinds, right? So then like fast forward to the 60s and the 70s, there's some stuff in US child welfare policy, right, where we kind of move away from psychoanalysis because Bruno Bettelheim comes along in the 50s and says autism is caused by what we call refrigerator mother theory or child negligence. And so you have thousands of kids in the United States taken from their parents because they in fact have autism, right? And so there's sort of this reaction from behaviorism to that and to psychoanalysis, which I imagine you as a psychodynamic practitioner know better than I. But sort of behaviorism was the push in the 60s because it's observable, demonstratable. And so you see this resurgence of what is autism. If it's not this child negligence thing, what is it? And so then you begin to have this expansion of knowledge for the next 30 or so odd years, right? In the 80s, you had Asperger's syndrome. You also had autism spectrum children's disorder, which then becomes autism spectrum disorder, where there's also child disintegration disorder, Rett syndrome, and there's one PDD-NOS, pervasive develop, not otherwise specified, but the DSM-4. Rett syndrome was sort of like a rule out. So if you had Rett syndrome, you couldn't have autism. You also have the development of what we call the ADOS-2, the Autism Diagnostic Observation Scale by Dr. Catherine Lord and her colleagues, and the Autism Diagnostic Interview Revised around the late 80s, 88, 89, because they were really trying to answer this question, like, and as Steve would say in the forward to my book, we spend a lot of money on what's called a behavioral phenotype. Like, what is a description of the way a person presents in the world action-wise? It's connected to who they are as a person psychologically. And so that's why you get the ADOS-2, which kind of influences it. And so then in 2013, we take all 4 of these diagnoses and put them into one. Now we have the DSM-5-TR in 2023, and there's 2. Because now we have a severe and profound qualifier. So is it all the same? I don't know. But there's a lot of people with a lot of thoughts on it, and there's a lot of history on it.
Well, and with that history, you mentioned Asperger's, and I understand that that's fallen out of favor
To some.
to some. Oh, interesting.
Yeah, I don't think it's uniform.
Oh, all right.
Like, I have people come in who say, I have Asperger's. And I go, okay, now what?
Now, the other thing I'm thinking about is the disability justice folks, and I've learned so much about this, but what are your thoughts about just disorder in the term?
So there is a movement in U.S. history, which you're kind of alluding to, which is the independent living movement, right? Which happens in the 80s to deinstitutionalize people. And that happens about the mid-80s, late 80s, early 90s, right? So you have this independent living movement, which is this movement about disability justice, and it gives rise to the ADA, gives rise to the IDEA law, which special education is governed under. And so the word disorder being in the diagnosis, I guess I don't really have an opinion on, truthfully. I think for me, it has been disordering at times, and it's also been really wonderful at times. I also don't look at myself and go, Sean's autism. I go, Sean's a person and he has these predispositions. You had Dan Siegel on your podcast, right? So he talks about in his new book, this idea of like these patterns emerging. He talks about parts. And I try to think about autism like that, right? Like, I have these parts of me, or these patterns that can be very rigid and can be very withdrawn and struggle with social skills and social cues. Right? So I have these parts, but they're fluid and they're verbs. They're not nouns, like Dick Schwartz would say. I love when Dan Siegel goes, and I said to the room of IFS people, they're verbs, they're actions. And I think he's right? So I think about autism this way. So yeah, it can be disordering, whether or not, I think people really, what I've learned as I've done this public speaking, circuit writing, book writing thing, is people really like to come after people just to be known. And I think it's a really sad state that the globe is in. So disorder, right? I'm okay with it. I don't have a problem with it. I think it can be disordering. I also think if we understand a single person in a singular word, there's got to be some advantage to them for that. And that's what my mentor, Pat Ogden, has said to me, is that as people begin to unpack this word disorder, right, and really fighting against it, they must be getting something from that, right? So I don't want to disqualify that, what they get from it. I just think this controversy over the word disorder feels surface level.
Oh, that's very interesting. And, Devin, are you familiar with Devin Price?
I am familiar with Devin Price. Are you familiar with Devin?
She was one of the people that, I'm sorry, I'm not quite, I don't remember the pronoun. It might be he. Was somebody that I had really tried to get on the show, had agreed, and just haven't quite. So if anybody has connections, happy to have him on.
Yeah, Devin's great. Devin has some really good work that I use sometimes when I have young teenagers, because I really like how Devin talks about identity for, like, say, like teens who are just beginning to go through identity formation, because I think that's valuable there. But I don't necessarily conceive of identity as a monolithic form, right? Like he does, or they do, or she. I don't know which pronoun Devin uses, but what I do know is that Devin sort of takes a very psychodynamic perspective, or Ericksonian, and I feel like interpersonal neurobiology for decades now has sort of disproved that. I mean, I think the Dick Schwartz IFS people have really kind of worked into that and really like kind of tackled, no, identity is not singular. Like, it's so much more complicated, right? Which is why you have to go back and listen to Dan Siegel. I don't know did he do his parts book here? His wholeness, quest to be whole.
We've talked to him several times. The most recent one was his most recent book.
How to Be Whole, or I'm trying to think of how to. It's the one where he does the Enneagram piece, right?
The
But that
Enneagram.
book,
Yes. Yes. Yes.
that
Yes.
book,
Yes.
I think that and Dick Schwartz's book. I'm trying to remember what the name of it is.
Well, we'll link it into the show notes.
This book's about parks. Really, like my understanding of the field of neuroscience is where we understand identity, which is why I like when I listen to these talks about disorder, not disorder, like my whole identity is disordered or not. It's like, okay, but there's so much more to you, right? Like this painting by A.D. Hogan. So A.D. Hogan does this amazing art with all these colors, and like this is a picture of the Boundary Waters, a place I hold dear because I've gone there for 9 years in a row. And I usually go around this time, and I'm not going this year for just, I've got stuff to do and other priorities. But like this painting, though, it's so much. And for me to just say, oh, this is a painting that's red and yellow and blue doesn't even begin to capture the depth and width and wonder of it. And I think people are like that. And so to boil a person down to a word, like I really struggle with like how hard that must be for them that that's what they come up with, because like holy cannoli, there's so much more to you. And I don't know, like I really struggle with when people don't embrace the complexity of who they are, because people are quite complex. I mean, you know this, I know this.
Totally. And, that's kind of some of the conversation is that there's no normal brain. And that just like in the beautiful color behind you, depending on what part you're focusing on, and then also different people see different things in the painting. But now, what do you have to say though about there's been a lot more visibility related to autism spectrum, what that means. There's a lot of adults that are getting great relief of like, oh, this puts all of these earlier experiences into a new organization of myself that really helps me. But there's also a pushback on that a little bit about like, what does that mean? Do you feel like there's any danger of somebody who might be socially awkward or feel outside of the norm to self-identify as autistic in a way that could be harmful to them? And I'm asking this kind of reluctantly, but I just know that it is a question of like, oh, everybody's autistic now. Everybody's ADD now. That is a thing that happens.
I think, do you remember taking ab psych in undergrad? And this is more just like setting the stage. It's not even to answer your question, but we need to go here to go where I want to go. But do you remember your psych professor being like, don't diagnose yourself, right? You're going to read this DSM and you're going to see yourself in 7 different disorders. And that's what everybody inevitably does. And so I feel like to some degree, part of like, there's been a definite movement towards person-centered practices, which I'm glad for. And there's also some things that actually, and some skill and hours we put in to become licensed as therapists or psychologists, and some like tools of the trade. And so like, I think there is sort of this underbelly of, it's a very helpful frame. It gives us connection. It gives us community. Like if I had to guess what Devin Price would say, it would be that by being autistic and identifying this way, I find other people who I resonate with. A beautiful and wonderful thing. And I think that's helpful and amazing. I also think I have a story where I had a client and we use a tool called feedback informed treatment. And there's like it goes up, it goes down. It sort of looks like lasagna noodles, and people do this every week. It's 4 questions long. And I had this client who was convinced she had ADHD. And I've suggested a mood disorder, and like not knowing that there was all this stuff around mood disorders, and just got blasted for it. And it's like, there's a sensitivity that just exists now where I'm really concerned about the level of sensitivity people have, because I wonder about, is our level of resilience declining as a culture? And that's bigger than being autistic or ADHD or whatever, but like, I really worry about that, because I look at the last 8 years in politics and you can see people getting canceled from both sides of the aisle. And it's like, okay, but hold on a minute. Like, we're all one country and we all like, we might not agree, but we all at the end of the day still want democracy, hopefully. And so like, to me, this feels like an outshoot of that. Like so like, is there harm in it? Potentially, right? Like, I think there's more harm in like defining yourself with one word than there is per se with like being identified as autistic. On a practical level, I think, right, like people need, as adults, need it for Social Security or accommodations. And accommodation is a protection. I think there's a lot of value to that. I think one of the things we learn in therapy school, like if anyone's to blame, I think it's the therapy schools, right? Because like psychologists kind of go one way, social workers, counselors, and LMFTs go another way. And it's like they land on different things, right? So like in Wisconsin, you can't be a master's level person with the training of autism, like the Autism Diagnostic Interview revised, and bill Medicaid for it. Even though we can test it, we fight it, we can still do it because National Association of Social Workers fights for it, right? So we can do it, but we can't bill Medicaid for it because the psychology lobby has said, no, we're going to do that. Nobody else can. And I think that siloing is part of why we're having this debate, and perhaps arguably the bigger, more nefarious problem. I do think that there's some value in like it's a test and it's rigorous, but I think the danger is a lot more in the fact that we have this dichotomy to begin with, where now people are seeing themselves in a singular word rather than seeing themselves in the painting.
That's very interesting. And I want to, you described a lowering of collective resilience, which will get us into polyvagal here in just a moment. But before we get there, if there's someone listening that is like, oh, maybe this is me, what do you recommend? You mentioned one instrument that is a evaluative instrument. Like what does that process typically look like?
I mean, I think that process looks like finding a good person you trust. Ideally, there's a vibe check and you find a therapist who you trust, who feels safe enough to receive negative criticism on their performance, right? Like somebody who really does have enough, like, I'm trying to think of the word for it, but like enough window of tolerance, like enough ventral regulation, or like enough of them online that you can be like sort of back and forth with them. And like, they're going to give you good feedback and be your loyal opposition. You find somebody like that, and maybe that person gets the autism mental status exam from online, right? And you guys just do it together, or you have a conversation about it. And it's like, does this make sense for me? Does it not? Because I do think that 3,000 hours that gets a person licensed matters. Like, I think all the things we do in graduate school matter. And to say those things are not important because I believe I'm autistic, great, doesn't change the fact that like you don't just become a plumber by like going out, I want to fix things like and just wrench them. Like we don't just allow me, who has no plumbing skills whatsoever, to come work on the plumbing in your bathroom. It would end very badly. And so I don't think it's any different with diagnosis. And I think really like you find somebody you trust who has that loyal opposition, who has your interest at heart with you, you have a conversation about it. And from that conversation, you decide, do I want to get a referral for testing or not? And in some cases, testing is not accessible. And so self-diagnosis is a great option because sometimes employers will take that. I don't know that it's a one size fit all, but I do know that like having somebody who has gone through therapy school does matter.
So what about, speaking of that, therapists who say that they are neuroaffirming? What does neuroaffirming mean?
Neuroaffirming it means almost nothing anymore. I think the intent is to say I'm person-centered. I think the intent is to say I value people with autism. I think what happens is you get everything from people who do discrete trial methods saying, we're going to do it exactly my way, and we're going to do it only as the family wants, not as the kid wants, to behavior analysts who are a little less like that. And they're very like, we're going to work with the parents, we're going to work with the kids. And if the kid says they don't want this, we're not going to do that. I think you can get into therapists who are like, I believe whatever my client says, right? And my client always knows best. And it's like, well, are you doing therapy or are you being their friend? Because like being a therapist means you have to be the expert sometimes. You have to be the expert in coping skills or psychoed or polyvagal theory, right? Like the strategies, they pay you. They don't come to just do tarot cards, right? Like it matters. And so to me, neuroaffirming is a meaningless term that like, I don't, in some circles, I hear it's a red flag for people because they look at it and they go, this is really unhelpful. It doesn't tell me anything other than their virtue signaling. And so I think what a person actually is about is a lot more important than using some word to describe themselves.
Well, let's get into that then even more around, like, what is the difference? Like, so if you're working with an autistic client, this will begin to move us into polyvagal. Like, what are some of the differences, and how do you work differently?
Sure. So I'm going to start sort of from my model of like, how does Steve conceive of polyvagal theory as a model? And then I can bring it to some specific cases because it's a both and, right? So, like, my view of my autism is that when I am more in flight and threat, right? So when I'm in that sympathetic activation, that fight flight place or that dorsal place, I'm more rigid. I make less eye contact. I pick up on less social cues and I'm less able to access ventral state, that place of feeling safe. Right. So the research Steve and people who have followed Steve's work have done in the tradition of research around autism really have found that people with autism disproportionately have higher heart rates than those without. And so that means there's a smaller window of tolerance and more likelihood they'll be in threat. And that could be for any number of reasons. I actually think that has a lot more to do with biology than it does like neurology or gene sequencing. I just think there's so many biological overlaps with like GI problems, vomiting problems, IBS, things that we know are variables in the scientific literature of heart rate variability literature that give rise to increased HRV. And autism is a population in which those are in spades. And again, it also has to do with how wide and complex and how narrow we have this one disorder over the last 70, 80 years, right? So, like, that's part of it too. And so when I understand people with autism, when I work with them, I just start with, it feels like you're going really fast and you're in threat. Because usually when they get to me, they are, right? I work with convicts or people undergoing criminal trials presently. And I work with a lot of adults with a lot of horrible things. And so the cases I tend to see are pretty severe, but what plays out is often this overexpression of dorsal and sympathetic activation. A lot of fight flight, a lot of shutdown, a lot of high sensitivity and rigidity, and this inability to be flexible, and this frustration with themselves for not being able to be more flexible. This frustration with themselves for not being able to be like, to be able to like just ask somebody out or like to talk to a bartender. Like, I have this one client who has treatment resistant depression and autism. And like one of this treatment plan was like, let's use big data, right? There's a tool, it's called I think it's like openai.com. I can't remember the name of it, but it's a Mayo sponsored ChatGPT that pulls from the New England Journal of Medicine. And so we did this and we pulled what are the treatments for treatment resistant depression. And so it was like ECT, TMS, ketamine, and intensive outpatient. IOP was out for him. So we looked at all of them. We looked at cases and he landed on ketamine first. He had like a 25% increase in scores, but it was on Ativan. The Ativan got cut because some nurse decided they thought they knew better than the doctor. And we're like, you need to take this off so we get the results we want. And so like maybe medical malpractice, maybe not. I don't know. Not really relevant to what we're talking about though. What we're talking about though is like that really ruined his experience of ketamine. But when he came off it, he didn't lose the gains. And so the ketamine, so we've actually done a lot of CBT because we did some sensory motor psychotherapy around the resistance to life could get better. The belief that life can improve almost seemed like a lie, but he could start noticing it. And so we've done that. And one of the things we've done is really begin to just track the belief, which is a pretty normal thing you do with CBT with anyone. What has been different really is like noticing that executive functioning can affect a sense of time, right? So he has difficulty with the sense of time. Like his emotions feel like forever. So narrowing his language, right? Because people with autism struggle with expressive and receptive language. So making him actually identify exactly what it is has allowed him to like feel like he can make moves and strides forward in dating, right? Now he can like say, I need to start learning how to drive again because I had this panic attack. It stopped me from driving. And I need to make some progress on that because that's a key feature of dating, right? You have to actually drive to the date. And so that can give him a sense of autonomy and freedom and not feeling so depressed because it doesn't feel so endless, but modifying the language, watching the language, and addressing that sense of time to be specific.
As a listener of Therapist Uncensored, I don't have to sell you on the value of getting therapy. However, many of us, go on autopilot and we just get used to the struggles that we're having and kind of count ourselves out. Well, we want you to know that it's okay to get help no matter your age, your background, or whatever it is that you need to work on. Growth Therapy offers a new option to make getting therapy much more accessible for more people. They will likely take your insurance, which is amazing, and they even offer extremely low-cost options for many patients. They also offer in-person care, which is fantastic. And if you need psychiatric support, you are covered because they have a range of professionals that will meet your needs. And okay, therapists, gather around, heads up. You knew I was going to check this part out, right? Growth Therapy is known for treating their therapists well. And after digging, I found they pay better than other online providers and overall have strong support from their employees. This is part of why that we are very happy to have them as a sponsor. Setting up sessions are easy, it's private, and very convenient. And I hope that by supporting this incredible sponsor, that we're going to help more people get therapy all over. So whatever challenges you're facing, Growth Therapy is here to help. Sessions average around $21 with insurance, and some pay as little as $0, depending on their plan. Visit growtherapy.com/TU today to get started. And of course, availability and coverage varies by state and insurance. So check it out at growtherapy.com/TU. That's growtherapy.com/TU. Check them out. So going back for a second, so you said that heart rate variability and then resting heart rate, those differences. And let's just, make sure that people heard that.
So to slow it down a little, because I tend to go really fast, right? There's that whole people with autism go fast thing in action. People with autism tend to have really fast heart rates, population-wise. That's just a fact. Cardiovascular diseases are at higher rates in people with autism. Life expectancy is shorter. I'm not going to say by how much because that's disputed in all kinds of ways. And people go back and forth, and I'm not a cardiovascular researcher, so I'd be outside my lane to kind of comment on it. But really, categorically, people with autism have higher heart rates. It means they have more sympathetic and dorsal activation, right? It means they go into fight, flight, and shut down quicker. It also affects your prefrontal cortex access and affects how much expressive and receptive language access you have. And so when I work with somebody with autism, or I'm working with an agency that wants to work with autism, and we're employing my model, really what we're doing is we're looking at, if you have a client who's in threat, what do you do to make them feel safe? Because that's really what the bottom line is. It's really about just creating safety.
Which applies to so many things, right? So to translate that for our listeners that have been listening for a long time and know kind of our thing, which is the attachment spectrum, which is really about activation, that so sometimes I like to say it back to make sure I understand it. And also, right. So from our model, we describe kind of the upregulation, downregulation is like red is the, we get wound, up, and then the blue is down, and it's variable colors, right? It's a very slow spectrum. Green being ventral vagal in the middle, and we call it window of capacity.
Is it the same as window of tolerance?
We're trying to expand that a little bit, right? It's not just tolerating something, right? It's like, oh, I have this rich capacity to have a feeling and stay connected, right? So that with autism, the threat response would be faster to come on, stronger to come on, almost more of the default, so that green zone would be tighter and tighter. So focusing on, and again, this is true for trauma, true for so many things, but so really, really focusing on safety. Now, what does it look like to focus on safety in session?
So it's a move. It's the only way I can explain it. It's not great. I'm going to really botch this, but so I'm an SP person by trade. That's a lot of what I do is sensory motor psychotherapy. I do some other things, but this is a big part of what I work with people on. To me, this looks like I had a patient once who was Aryan Brotherhood member, very brought a knife into our first session kind of thing. To give you a sense of my world. And wanted to work on trauma, right? And was able to do that, but only after compound naltrexone, only after like several months of resourcing and coping skills and just trying to feel like what it feels like to slow down. I think about that in terms of like, so some months back, the universe kind of imposed on me through one of my friends. They were like, our faith tradition, right? It talks about generosity of time. I'm like, wait, what? And like that sat with me. It wasn't like a command or do this. It was just like a sense of like I was going really fast and there is this way people can use time where they have more to give. And I wanted more of that. And so I scaled back some of my work and scaled forward some of my industrial organizational work. And now I take Friday afternoons off. But at the first part of that was really hard because I didn't know how to define myself other than by what I produced. And so this sense of really needing to go fast, to be constantly productive in order to have value, like I didn't feel good. Like I felt crappy, but like also like I was going so fast and had for so long been in this patterned way of like being productive to find worth, to say to others like, hey, I'm worthy because I did this thing, right? Like it's very different than someone looking at me and going, Sean, you're lovely and I like the color of your eyes and it's okay that you're triggering at that kid's laughter because that's normal for you. Like it's just so different. It's such a different space. And so I think it's this move from the like threat into the safety, this move into like I wish I could like quantify this down and make this more specific for you, but it's just like people start to notice how fast they're going. And it's like, first it's like a tears thing, but then it's like this gradual shift to like, oh, I can actually go this pace. I think we saw it during COVID a lot, right?
Well, no, I just felt it. I just felt it as you were talking. Yeah, I felt like there was a pace change, a shift, a tone change, and I could feel it on this side, like this kind of opening, and it felt like maybe you also opening, and it was really, really powerful.
I mean, and the way you contact that and track that in session is exactly like you're describing me somatically, right? Like my pace, speed of my words, the speed of my thoughts. Am I going round and round about a thing? Am I inwardly or outwardly focused? Like, am I focusing on another person when I'm there for therapy to work on me? Right? Like, do I need to just ramble endlessly or can I be attentive and present with self?
And what about attachment as it crosses with autism?
So I can only speak to my experience on this one, but I'm going to try to speak to this one in my experience. So for me, attachment, I think at a personal level, like it takes a lot of work for me to open up to someone and really have that connection. And so I tend to be very anxious and sort of pull.
You lean red.
I lean red. Is that how you guys say it? When you lean red, you're more anxious.
Yeah, and we say lean instead of you are red. It's like you lean. Under
I like that.
yeah,
I like that.
under stress you lean red.
Under stress, I lean red. I try to run away from. So I've spent a lot of time like really trying to get into. So in romantic relationship, when I'm in it, like being honest is very threatening because the safety feels like threat. The being seen and vulnerable feels like threat. And it hurts so deeply. Like I'm dating someone now and they have a kid and their kid was laughing and my window of capacity, as you guys framed it, I love that term. Like it's just narrower because I'm just waiting for the other shoe to drop. Like it's like I can feel the connection. I get these little texts like, "Hey, did you sleep well last night?" Or "Hey, text me when you get home." Like these very little like touches, which I think is really I think the bids for connection are really common in their non-autistic connection. And so I think autistic people in this way, and I would say this would be similar for somebody like you talked about, like people who are in threat. So people who are in chronic PTSD, where like their bids for connection feel threatening to them because it's like a nervous system in threat doesn't really know how to interpret safety. It misinterprets it. It's sort of like Steve says, do you ever listen to the Ramones and you listen to Ballroom Blitzkrieg? It's like 173 beats per minute. That can feel really good. You can get stuck in that and doesn't make it healthy. And he's just so wise in that way. And I think really that line of thinking speaks to what we're talking about. In terms of my autistic clients, I find a lot of them, like, it's amazing to me how many of them like end up crying and like telling me things. And I'm not even like, I don't I don't even say like sometimes you struggle to feel your feelings. They just come in there and they're like, I don't know how to feel this. And it's like, why don't we just slow down? And sometimes it'll take some redirection and some jockeying and some like, hey, are we here to do this or not? But like a lot of times when it's like a really gentle like framing of what they've said, it's like holding a mirror. And when I hold that mirror to them, it's amazing how often they can feel their feelings and be in them and have the capacity to go through them. So I think there's like a real dimension to threat and attachment in a nervous system that's in threat, like an autistic one.
The way that we think of it is yeah, but they're separate. That you've got the biology related to the and just the all of the factors that lead to, that make up autism. And then separately, you have a relationship with your folks, and you have pattern learning that then later gets translated as behavioral patterns that we call attachment patterns.
And then just to make it more complicated, you can have really good childhood experiences and you can have autistic people come out who are not in threat. And it's like there's all this biodiversity.
That's right. And it's beautiful. And so the idea that you can have autism and be secure, you can have autism and, have the whole range. And then my understanding, because it can be, if we think of parents and under-resourced parents, and then autism potentially adding more strain to parenting. So you're going to have an increased chance of not getting the best parenting that isn't anybody's fault, but just kind of like poverty or, you know what I mean? Like it's a risk factor.
Right. Or trauma. I mean, so like one of the things we talk about that I'm not endorsing the refrigerator mother theory. I want to be very clear about that. But there are a lot of presentations that look like autism that are PTSD. There's like a 25 to 35% misdiagnosis rate for autism on the ADOS2. But you got to think about education and therapy school again. It's like back to this thing. Like they don't learn in developmental psych programs to a great degree about what we learn about in our mental health programs. We have like 50, 60 credits in not in social work. Like in other like LMFT and LPCs, like just in clinical psych or just in like psychopathology or adolescent like development. Like it's just if it's all one thing, right? How we're doing the testing and like really does create the system that we have and the problem before us. And so to me, it's the educational institutions, it's the grants, it's the things that drive like the ownership, because the people who own the ADOS make a lot of money on it.
And the ADOS will link in the show notes. Is that something that is publicly available or?
No, it's a test that the Western Psychological Services publishes. So it's a privately held, but there's lots of people who do the ADOS too. It's a great test. It's just that only a certain few people can license other people to do it. So it keeps the number really small. The system.
And you said a stat that was important about what was the overlap?
25 to 35%. So there's 3 studies. I can send them to you. But they did tests they basically took a bunch of people that were diagnosed with autism, tested them again for PTSD, for false, and the ADOS too. And there was like a 25% error rate. And they've done this like 3 times. And like at one, it was like 30, another was 35. I can send you the studies, but like that range of error, it's 1 in 4. Like, holy cannoli. No wonder we have this conundrum.
Right. Well, and it speaks to what we had started talking about at the beginning of the interview about, self-diagnosis and like, is it, would it be better to think, oh, it's because of my chronic PTSD that I have this, small window of capacity, or is there something neurological or, developmental related to the autism spectrum?
I think it ultimately comes back to whatever you call the thing is almost innocuous to how do I help the person in front of me. My old boss, who's my current supervisor, I joke with, I used to be paid to go to supervision with her and now I pay her for supervision. It's a weird conundrum. I don't know what's wrong with me, but right, like where I'm going with this is, right, like she used to say, I'm a paying dues member of the Church of What Works. And it's all back to that piece about safety we talked about. How do I help a person who's in threat feel safe? And there's so many layers to that, whether it's biological, whether it's sociological, So like Devin Price's sociology sort of approach to this has been like largely influential in like post-secondary education, job vocational training programs, right? This whole neurodiversity movement. There's this whole movement of I need other people to change. And like some employers will do that. Not all employers will do that, but like has been beautifully helpful to some people in feeling safe. It's not the only way.
So actually, that brings up, people had sent in some questions, and there was this question about some well-meaning people create programs for autistic children, what have you. And so you're going to often run into things that fit outside the norm, stemming behaviors that make that make what's neurodiverse? What's the opposite of neurodiverse? Like, because it's not norm.
Homogenous.
Yeah, homogenous.
Homogenous.
That's good. That make people uncomfortable.
Mm-hmm.
So do you have suggestions about those kinds of practical things? Because there's a tension about like, oh, I need to teach them not to STEM in this environment so that they fit in versus changing the environment.
I tend to like fall on the side of I'm a pragmatist. I should just start with like and I'm a little agnostic on which is the right one. What I will say is most of my neurodiverse friends work in ivory towers, and I'm hoping are beginning to realize what's happening and how scary the globe, not just America, is right now. Like the globe, the planet, there is a movement almost like
the planet is in threat response.
The planet is in threat. Like we are moving backwards, not forwards. Like I got a thing from somebody where they were like, this is neuro-inclusive housing. It's like housing for autistic adults. I'm like, this is segregated housing. This is no different than like putting Black people in their own school. Like, and so like, I'm very mindful of that thing. So like, my answer is always like, where is the world in threat where you are? And like, how do we like, because I don't think every environment's the same. Like if you work at Goldman and Sachs and they're all like, we want to keep our employees happy, right? Like very different than if you work on Rice Lake Weighing's floor, right? Where it's a factory where they do actually have neurodiversity initiatives, but it's definitely not what they do at Goldman and Sachs, right? And so I don't know that there's a one size fit all. I think it really, I'm a pragmatist, right? Like I do a lot of work with people. Like I've had clients who want to learn how to unmask and really go into that. I've had clients who are business owners and need to mask to manage politics with like different elder populations within a Native American band.
But what you're saying,
give you a do this.
No, but what you're saying though is that it's client driven. It's what the what serves the person.
That's what being person centered is. Yeah, it's not what I bring to it. It's not which is where I really depart from a lot of the other neurodiversity advocates, because I think there's a thing about like sales, right? Wanting to make a living at this, but like that business interest can't override like a person's right to choose for themselves what's right.
Now, earlier we just touched on your research, and I just wanted to just ask you about it. Like, just in short, kind of what was it? What did you learn? What's the highlight? What are the highlights?
So a short synopsis is I had a team from UW-Eau Claire and Mayo Clinic Health System, and we looked at can we increase access in rural healthcare providers to autistic children or autistic-like children by giving them 4.5 hours of just, like the dynamics of like just training on autism, right? So like 2 hours of didactic learning, 2.5 hours of consultation. We started with 11, we ended with 3. We did it for 9 weeks. The maximum amount was 3.5 hours, right? We found statistically significant change on a verifiable instrument. I can give you that if you're interested, or people can find me on Instagram and connect with me that way, and I can provide the instrument's name. But we did this therapy competence scale. It's like a 14-item thing. And really, there were no changes in access. One of the factors we didn't really consider when we did the research was doctors only see people once every, 6 months or a year. Once every 6 months is a lot for a pediatrician. And so what we learned is that you can increase confidence. And really where that's taken me, so I did that at another place, Polyvagal Institute, and I did a training. We used the same instrument. We had 500 responses this time, as opposed to the 30 we had. And again, no change in access. So what I'm coming to realize is like there's this quandary. It's really an ethical quandary in my wise. Like it's social work ethics, because there's a real right to like only doing ethical practice, but how we define ethical practice is really what are we comfortable with and what are we not comfortable with. So if you can treat people who are providers, right? So like doctors, social workers, dentists, right? As if they're people who are like through sort of like a MI lens of like this movement from sustained talk, ambivalence to change talk, ambivalence being where they have both sustain and change and sort of treat. If you apply this lens to providers, a lot of times they'll work through that discomfort. And so for me, really what I do when I work with agencies is we work through that discomfort of working with people with autism. Like right now I'm doing a dental presentation. My whole thing is I want to pick up some dentists to try to work on their discomfort, but like willingness, because we have a shortage of dentists in our region doing like adult and pediatric like cases for intellectual disabilities. So if we can build their confidence, maybe some of them will go get ER privileges. Maybe they'll do some surgical procedures. Maybe some people will stop having so much dental pain because those providers are confident enough to do good work.
Well, it sounds, like, again, so multi-layered, but I love, like, so that you can
Hmm.
have a very confident provider and not necessarily change access yet.
No, but I mean, even if you affect one, you can affect access because then they take the moves, and just because it's not an immediate, it's a downstream effect.
So is there anything for those listening, and again, we have a mix of therapists and non-therapists, that we haven't said yet that you really want to convey from your research, from your experience, from your life experience that you want people to know?
I just think life is this dynamic process, right? So there's this, I'm going to cite a really obscure Bible passage. It's Genesis 11:31, and it's the story of Abraham leaving the land of Ur and going to Canaan, right? And so the land of Ur is somewhere like where modern day Kazakhstan or something is. And so it's this short one-line verse, but really I think that is the entire experience of being human. We have certainty, and we kind of move from knowing into unknowing, into more knowing, and back into knowing. And so we go from Ur, we go through the wilderness, and we eventually arrive in Canaan. And so that experience, just to me, that's been my experience in working with people and sort of working through their uncertainties. It's really about moving through the unknown with an open heart, because without that sense of openness and willingness and curiosity and that shutdown and that threat, like where is the wonder?
It's beautiful, and then with wonder, you can't feel wonder and awe if you're not in your window of capacity, and wonder and awe builds your window of capacity.
Right. And it is this just beautiful place to be, but it also takes some risk. So I guess my thing is like lean into the uncertainty, lean into the discomfort of safety.
Can you give an example in your training? How do you teach people to be more comfortable and more confident when it comes to people that are different than them? Can you just give an example of like what works?
So we worked with Mayo Clinic, right? And this doctor like started talking through, he had this case coming in where this adult was going to be establishing care with him, and he was nervous about it because there was a guardian. He's like, who do I work with? Like, this is so odd. There's a guardian, there's a person. I listen to the guardian because legally they're responsible, but not really. So like we just kind of worked through that. We just kind of like played out, well, like if this was you, what would you want? Well, like I'd want to be listened to. It's like, so then maybe you already have this answer and it's not as hard as you're making it. So like he leaves, 2 weeks pass, he comes back and he's like, so they came in and it went really well. I'm like, okay, tell me about it. And he goes, the guardian comes in, the guardian says, this is what we want. And he's like, hold on a second. Like, I understand that you legally have the say, but this is a person. We value this person, even though they're an adult with a guardianship. They are the decision maker here, not you. So let's just start with them and what they want, and then we'll get your input. And just hearing that physician say that to that and hearing that story, just like that's what it's about. It's about leaning into the discomfort, going to the vulnerable places. As Miss Frizzle would say, get messy, take chances, and make mistakes. She's a Magic School Bus character who I adore. Like, I wish I had her as a teacher, never did, but
Well, I love it. So yeah, that folks that are impacted are the ones making the decisions and consulted with, and that are leading it. I love it. So you mentioned people could reach out to you on Instagram? Can you go ahead and give us any of your socials? How could people reach out?
Inderbitzen.consulting is where people can find me online on Instagram. So that's one way to follow me. And then the other way is on LinkedIn under Dr. Sean Inderbitzen, not Sean Inderbitzen, because if you follow that one, I never got it. So Dr. Sean Inderbitzen, though, is the home for Inderbitzen Consulting Services on LinkedIn and Instagram. So those would be the two places, and I can provide you those handles afterwards too.
Okay, great. Well, we're going to put all of that into the show notes. And you have a book. We haven't mentioned the book. Let's talk about that.
So I have this book. It's called Autism in Polyvagal Terms, and it really covers a lot of Steve Porges' science on what does he say about autism? What does the research say about autism? How can we apply that to decrease a sense of rigidity and increase a sense of connection and flexibility through strategies like motivational interviewing, mindfulness, safety, somatic resources, biofeedback, and social work pedagogy.
That's great. And I'm curious, how does a book like that do?
It's done okay. It's weird how well it's done. Like, it sat at like 75 in medical neuropsychology this past year, which like blew my mind. And it sat at like 80 for autism child spectrum disorders. And I think it was like 125. But like, this was for a solid year. Now it's a little further down the list because it's older, but I'm really excited about it. I mean, I broke even with Norton. So like now we're at the part where they're paying me more in the royalties. So every sale I get money to my pocket.
You get a couple of pennies.
So I do get some pennies, and then they've been really open to new books. So we're doing a flip chart, an Autism 101 flip chart that'll come out next year. And then we're doing this. I wrote a memoir style self-help book. It's called Neural Exercises for Autistic Adults, Finding Meaning, Flexibility, and Joy. Or it's like Meaning, Flexibility, Connection, and Joy. Something like that, right? Like, I don't remember the exact title, but it's like 11 chapters, and it's really all the stuff we're talking about, ranging from the identity, what does the science say about that, how does that relate to polyvagal theory, and how do we move through that to connect to ourselves in deeper capacities.
And if you are local, November 7th, austinandconnection.org, you can catch you. Are there any other presentations that you're doing, public presentations that you're doing?
Actually, yeah. Honestly, in Wisconsin, I'm doing a couple, or if you're in the Lac de Flambeau tribe, of all things, right? So I'll be doing 2 in Ashland in October and November. October 23rd, I'll be in Ashland, Wisconsin for the Children's Resource Center of the North to have a conversation. And then the 28th of October, I'll be in Hayward, Wisconsin. And then there will be a conversation. There will be 2 more in November. And then there will be a conversation with the Lac de Flambeau tribe as well. So if you're around, also, if you're in Eau Claire, Wisconsin, I'll be doing a presentation on the 13th of October at the Country Club there in town with the Chippewa Valley Dental Association. So if you're connected to that and you're a dentist and you want to come hang out, come hang out.
That's great. And if you're hearing this episode after all those things, just check in with his website and, see if you can track him down. So thank you guys for listening. If you've been listening all the way through, then this is something that content that you value. We encourage you to share it with someone else that you think could benefit, and to slow down, stop, and give us a rating and review. That's the most direct way to help our podcast grow and to help this totally free and accessible, I think, high quality guests and content out to the world for those who otherwise don't have access. So rating and review is really helpful. And last thing is we do have a private NeuroNerd community, therapistsuncensored.com/join for as little as $5 a month. You can join us there. You get extra content and a commercial ad-free feed. All right, we'll see you around the bend.
Therapist Uncensored is Ann Kelly and Sue Marriott. This podcast is edited by Jack Anderson.